Thanks, Alex. Are you able to explain what factors potentially increase the risk of getting and developing cataracts?
A family history of cataracts, so genetics, they run in families. So on the whole, if you were to take somebody from rural Bangladesh, where they might have a higher incidence of cataract, and move them to London, they'll still get their cataracts in maybe their 50s or 60s. And if you were to take a Caucasian man from Glasgow and put him into somewhere which has had a high lot of UV light, like somewhere in Australia where maybe they have increased UV light, they'll still develop their cataracts in their 70s and 80s. So you tend to take your genetic load with you, and that's what determines your cataract. Other things that can cause cataract that are important would be any injuries. It can be blunt injuries, so sometimes people might have a head injury from a car injury and then 10 years later start to develop a cataract on the side that they had a head injury, and it doesn't have to be a penetrating eye injury, well that is much more likely to cause cataract. Drugs, or meaning treatments and medications, can cause cataract, particularly the one that real take-home message is steroids. So steroid puffers from asthma, steroid creams, especially if you're using them around your eyes, and steroid tablets can all increase the risk of developing cataracts. As we get older, we develop cataracts such that 50% of people in their 60s will have cataract, and 100% of people in their 80s will have cataract. So age is clearly a very important factor in developing cataracts. Although having said that, very rarely babies and children can get inherited kinds of cataracts, and cataracts that are associated with some metabolic problems. Smoking is associated with cataracts, and less so diabetes can also be associated with cataracts. But diabetes is more famous for causing problems with the eye, with the retina, and upsetting and blocking and leaking the small blood vessels at the back of the eye. So it's the retinopathy that can be caused more by diabetes, but cataract a bit too.